You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with sleep apnea. And if you can't wear a CPAP device, you have to hear what my first guest has to say. Also snoring. If your husband snores, if your partner snores, if you snore, you got to hear what Dr. Marinic has to say. Dr. Marinic, welcome to the program.
Thank you.
All right, now for people that don't know you, we've had you on the program before. Tell us a little bit about your practice, like who's the typical patient, and what are the different services you offer?
Well, usually they're adults, and oftentimes the wife lets the husband know that they've been snoring and they can't take it anymore. And so they come to our office and they try to figure out what the treatment options are.
Okay, now you've been doing sleep apnea for quite some time.
About 15 years.
So it works. This appliance therapy, these custom-made appliances, get people off their CPAP in certain cases?
In many cases. So the CPAP is used for patients that have sleep apnea. Phenomenal, works very, very well for those patients that can tolerate it. But if a patient can't tolerate it, then they typically just stop wearing the CPAP and they remain untreated.
So are there a lot of people that don't wear the CPAP device that have been diagnosed with sleep apnea?
Absolutely, about 50% in fact. So some people, when they get their CPAP, and they get a portable one. For example, we had a fellow in the Boy Scouts that was camping, and it was so loud it kept the rest of the troop up. The poor fellow never came back to any other campouts. And we hear stories of people trying to travel with the CPAP machines, and it's cumbersome, and they can't sleep on their back. They wear it for a couple of weeks, and then they just stop wearing it altogether.
But they work, right? I mean, is that right?
They absolutely work. There's no question that a CPAP works, but also the intraoral appliances will work for patients that have mild to moderate sleep apnea. And in cases of patients that have severe sleep apnea, if they're intolerant of a CPAP machine, the American Academy of Sleep Medicine recommends it as an alternative treatment.
Now, what about people that are loud snorers? Maybe they're not sleep apnea diagnosed yet. Does it work for those people?
It works very, very well for patients that snore. And oftentimes, instead of their spouse leaving in the middle of the night, they're back in the same room together. So it works wonderfully. We do have to rule out that they don't have sleep apnea, but they work fine for patients that snore.
So there's at-home tests that you can give them to see?
Yeah, so there are services that do an at-home sleep test, and the results are read by a physician and reported to us. We want to verify that they don't have sleep apnea, and then we can fabricate a device that eliminates the snoring. And they work out really, really well.
So sleep apnea, well, I mean, okay, so what defines sleep apnea? And how bad is it to have it?
Well, sleep apnea it's on a range. It starts off on the one side as just annoying snoring, and it can go all the way to be life-threatening, where patients that stop breathing 30, 40, 50 times a night for each hour, they're at increased risk for heart attack, stroke, hypertension. As soon as you stop breathing, your heart starts pounding more to try to get blood and oxygen to the tissues, and there's no oxygen for it to give. So it can be very dangerous.
Is this true that people have sleep apnea may not even know they have it, or they don't even believe it?
Most patients don't. They start off, they think they just snore. And then sometimes they'll be a little bit tired in the morning. And then as the years go on and as they age and the tissues become more relaxed, they become more and more tired. They're not even aware why they're tired in the morning. A lot of times, they'll stop participating in activities, things that they used to enjoy. They just stop doing it.
So they think they're sleeping, but they're not sleeping?
No, each hour they're actually stop breathing, usually 30, 40, 50 times in an hour. They stop breathing.
So when you do these sleep studies at home, it'll show they're waking up like 30 times, 40 times in an hour?
It'll show the number of times they wake up. It'll show
right?
What percentage of oxygen the blood has. There's a whole bunch of different metrics.
So you've had people that you've made a custom-made appliance?
On a regular basis.
And then they say, oh my goodness.
Yeah, usually within a short period of time. Because once the airway's open and they can breathe, they get a good night's sleep. They get 2 good nights' sleep. They get 3 good nights' sleep, and they start to feel there's a lot that happens when we sleep. That's the chance for the body to rejuvenate. You take that away from people for 2, 3, 4 years, and they're like walking around in a daze and they don't even understand. They say, oh, I'm getting older, I don't have the energy. There are plenty of people that are older that have plenty of energy. And a lot of times it's just because they just aren't sleeping.
And
at
they
night.
think they're sleeping.
And they're in bed for 8, 9, 10 hours, but they're not sleeping.
So they're tired
And their spouses will say they're snoring or they're making these gasping noises or a whole host of other things.
You say they sleep in separate rooms. They tell you this on the consults?
Very, very common. Yes, we ask that on our consultation. And it's very common for adults that where one partner snores, the other one just leaves, because otherwise you have 2 people that don't sleep. And that's really a lot of crabbiness in the morning.
So the partner is exhausted the next day too because they had to hear the noise.
Absolutely.
Interesting. Yeah. So this is a big problem. I mean,
It
there's
is
a lot
big
of
problem, right?
Now, okay, so I understand this correctly. Okay, and why a dentist is treating this. That these are people that breathe okay during the day. That means they're walking around, they're breathing. They lay down at night, they can't breathe so well. So what's happening? The jaw's dropping back? I mean, what's going on?
So what happens
and all
is
you're doing is bringing it forward.
the jaw drops back and it closes the airway. And once the airway is closed and the patient tries to breathe, it's like trying to suck in a straw where someone's squeezing the straw. The harder you suck, the air doesn't come in. And then the patient starts gasping. And you can hear it. Once the patient starts gasping, then they'll take another breath. But for that little instant, they weren't breathing, and the heart starts pumping like crazy.
And they wake up a little bit.
And they wake up a little bit, and then they go back to bed. So they're in bed, but they wake up in the morning and they just don't feel relaxed. They don't feel like they're well rested. So the appliance that's fabricated on the order of a physician by a dentist is to advance the jaw. When the jaw is advanced, it allows the air to go in, and then the patient can get a good night's sleep.
Okay.
And they work very, very well.
And now you wear one. Are we
do.
allowed to bring that up?
Yes, I wear one. I was one of the guys whose wife took off and went into a different room, and she's back again, which is very nice.
Okay. Yeah, because so is this really a big problem? Because I guess it's not something guys talk about, right?
No, but the women talk about it. When the patients come in, it's usually the wives that will bring it up about the husbands.
Is that right?
Yeah, I mean 50%.
But a lot of people have this?
50% of men above 50 snore. 60% of men above 60 snore. And a good percentage of the patients that snore actually have sleep apnea. So it's a very large percentage as we age.
So now you told me in the green room, right? And you said, I'm paraphrasing slightly, but you believe you have like the best appliance on the market today. And you're doing like CT scans to custom fit them.
Well, what happens is there are a lot of different appliances on the market. And most of the appliances that go in the patient's mouth, the way that you adjust them was kind of arbitrary. And you just try to get feedback from the patient that it felt
like
better.
Adjusting it where you have to tweak it to push the lower jaw forward a little bit.
Right. So here's an example of one. And so you ask the patient, it fits on the top and it fits on the bottom and it goes in their mouth, and you just ask them how it feels. But you can't really tell when you put it in their mouth what's going on in their airway. So it's based on feedback that you get from the patient.
Like they're saying, does your partner say you snore? Are
Say,
you
yeah,
still
you're
doing
snoring
it?
as much. Do you feel better in the morning? Recently, the FDA has approved a program designed to look at the airway as well as the jaw joints, so that when the appliance is made, and the appliance looks very, very
This
similar.
is the one you love, right?
This is the one.
You were raving about it in the green room.
because when you could show this to anyone that does these, and if they would actually look at this and had it in their hands, it's amazing the way this is made. It's made in Germany, and this appliance is designed by the CAT scan, by looking at how the airway opens as the jaw moves forward. So there's a device you put in the patient's mouth, you move the jaw forward, and you can look at the CAT scan and you can actually see how the airway opens up. So it's not arbitrary. This is the first time we've ever had anything like this. And so
you're doing it based on their anatomy. When you say arbitrary, you guys were kind of hit and miss guessing.
Right.
Or tweaking it as you go.
It was still effective, but it took a lot more appointments to get it adjusted just right, and it works. What this does is this allows you to pretty much get it right almost immediately.
Take a look at this.
And
do they say, oh my goodness, wearing this is tough?
No, not really.
It's little.
No, compared to the CPAP machine.
You can't even really see it here.
Yeah, compared to the CPAP machine, these are small.
This is small, yeah.
Yeah, it's small, and they're that one's magic.
It's magic.
It's magic.
Why?
It's magic because Some of these, when the patient wears them, the surfaces aren't smooth, and so as they move their jaws, as we all move our jaws back and forth at night, you can feel it kind of going up and down ridges.
So this one's more like a retainer where it has ridges on the teeth?
Right, and this one's flat like an ice skating rink. So when your jaw moves backwards and forwards.
When you're sleeping?
When you're sleeping, there's no contact at all on those back. It just, you slide back and forth and you can't feel anything. And it also has it so that when you bite down, the airway is open. A lot of these, when you bite down, if someone grinds real hard, you'll bite down and you'll close the airway. So you're pushing your jaw forward, but there's no place to get air coming in and out of your mouth. This one solves that problem.
So if you're going to get this done, that means, okay, so you're wearing a CPAP.
Right.
You hate your CPAP, let's just suppose, right?
Okay.
It works, but you can't wear it. You're considering this therapy. How does a patient know what to ask to make sure that the doctor is using the new modern next generation appliance like this?
Well,
that's tough to do, I guess.
It's tough to do. I mean, the imaging equipment that we have is designed by Sirona. It's a phenomenal piece of equipment, and they've developed software specifically for sleep apnea called CCAT Air, and the appliance is actually made off of the CAT scan in Germany. Very, very thin, very, very custom fitting, and if you were to look at 6 or 8 different appliances, this appliance,
you like this one?
It's magic.
Okay, it's magic.
It's
because it works.
It not just works, it gives the jaw freedom to move at night so you don't end up with soreness in your muscles. It allows you to breathe much better even if you're clenching at night. So it has a lot of different aspects of it.
So I understand this correctly. Okay, so normally they would put a lot of that goop in the mouth, right? You put like a wand, you scan the mouth, feeds it into the computer, and it custom makes an appliance based on their teeth. Is that kind of how it works?
Kind of. We feed it into the computer that's the same computer that has the image of the CAT scan, and we connect the two of them. And then that image is designed, and then that's sent via the internet to Germany, and they fabricate a custom appliance for the patient, and then they mail it back to us. And then we go ahead and we deliver it. And then we still verify, just like we did before, that it's adjusted properly. And we follow up with a sleep study and have the physician verify that they're happy with the results. Because sleep apnea, obstructive sleep apnea, I mean, it's a medical problem. We're helping the patient with a disease. We're helping them treat a problem that they have.
No more CPAP.
No more CPAP for those patients that can't wear CPAP. CPAPs are fine.
Now, what about medical doctors? How do they feel about it? Because they're the ones prescribing a CPAP.
Right, and they do, and they love it. Because patients that can wear a CPAP should be wearing a CPAP. If your physician prescribes a CPAP and you can wear it, by all means wear it. The problem is they know that they have 50% compliance. And the insurance companies now actually have chips in these CPAPs. So if the patient doesn't wear it a certain number of days in a row for a certain amount of time, the insurance company won't cover it. This is a durable medical device. This is typically covered by medical insurance. If they'll cover treatment of sleep apnea, which almost everyone does, they'll cover this device. So that's where I get all my referrals are from the physicians.
So the medical doctors are referring you patients?
They refer me patients for patients that are non-compliant with the CPAP or have snoring, mild or moderate sleep apnea. So the American Academy of Sleep Medicine in 2015 came up with new guidelines. And for those patients that snore, have mild to moderate sleep apnea, an intraoral appliance is recommended. For those patients that are intolerant of a CPAP machine, it's also recommended. We work with the patient's physician.
Okay.
The physician is involved to figure out what's in the best interest of the patient.
Now, as we talked at the top of the show, you have patients, and I'll make sure I'm right on this, that are waking up 40, 50 times a night because they do an at-home sleep study. After they get this type of a custom-made appliance, do you have proof that says now they're only up 5 times an hour instead of 50?
Well, that's the purpose of the secondary test. That's why we have that secondary test. And then they'll drop down. Anything 5 or below is considered normal.
And you've seen people return back to normal?
Yeah, I had this one guy whose physician prescribed a CPAP, and he loved to travel. He just couldn't travel with the CPAP. We went ahead and we fabricated an appliance, and within a short period of time, within about 2-3 weeks, we had a second test done because he was traveling and he was at risk for cardiovascular disease. So this was a guy that woke up 40 times every hour, and he went down to 4. When he would travel, he would be exhausted. And now, he's 60 years old, enjoys life, travels like crazy with his wife, and doesn't have to lug a CPAP machine around with him.
I told you, I get insomnia every once in a while. And when I don't sleep, it's like I'm hungrier the next day. My psychiatrist buddies that are on the show, they say, well, Randy, you rebuild your serotonin, your neurotransmitters when you sleep. So these people, I guess, aren't getting the deep sleep they need
just exhausted.
To feel good the next day.
They're exhausted. They walk around like a zombie all day long, and they don't even understand why. Because it doesn't happen, like you just mentioned, if you don't sleep for a day or two, that's how you feel. Some of these patients haven't slept for 10 years.
Really?
No, they haven't. They just kind of exist, and their energy goes down, their drive for things goes down, the number of activities that they do. People that used to participate in sports, they just sit on the couch and they watch television all the time.
So this is like that, that commercial where you get your hair back, where they're hunting and fishing and canoeing.
Enjoying life, whatever it is that they enjoy.
Sleep is important.
It's important for it. The patients are less grumpy. They're actually, spouses will say, I've got my husband back again. So what do you mean? He said, well, when I met him, he was fun. We used to do stuff all the time. We used to go for walks. Come back from work, all he wants to do is go to sleep. And I'd say, what do you mean? What do you do now? He's like, well, we're walking again. We go for a walk in the evening. We take the dogs for a walk. On the weekends, we do things. So it's amazing what happens when people get the sleep that they didn't even know they were missing.
This works. You say it's effective. It's FDA approved to eliminate or to help with and eliminate in certain cases sleep apnea, right? Then why does everybody do it? Why are they so resistant? Like I told you in the green room, I said, I have a friend, young guy, 38 years old, and he's been told by his spouse, chronic snorer, chronic snorer, chronic snorer. But he doesn't want to even entertain the thought of this. So what is it?
Well, he's in his 30s. He still thinks that he's Superman, indestructible.
All right.
As each decade goes by, people become a little bit more humble.
So do you think he'll get worse? Is that where it starts? Really loud snoring goes into this?
For him, of course, I hope he doesn't get worse.
Right.
But the reality is that on the continuum, it starts with snoring and it ends up with severe sleep apnea. As we age, if someone puts on some weight, simply just by age, the incidence of sleep apnea goes up. The beauty of handling it at the front end when it's not real bad is that the patient doesn't spend years of their life exhausted, not even knowing why they're exhausted. They have energy. They have, the desire to do whatever it is they want to do. And we have patients that, I mentioned the guy that traveled. We have patients that were going to go on a trip that was an extended backpacking trip, but the person didn't have any energy. He wasn't even heavy. And we went ahead and treated him. And within about 2-3 days, he started feeling better. After 2-3 weeks, he had his energy again. He was in there training, getting ready to go go on this trip with his son that otherwise he may not have done. He may have missed it. So
interesting.
It's amazing what happens when you wake up and you bounce out of bed and you're ready for whatever the day brings versus waking up lethargic after being in bed for 8 hours and still being exhausted.
How soon can it work? Okay, so you make the appliance, they go home. How soon do
the
they
next
expect?
day.
Really?
It can work the next day, absolutely.
They sleep that night?
Absolutely. Because what happens is, as soon as their airways open, they get a decent night's sleep. It may take a few days or a week before they start to really feel rested, because if they've been exhausted for years, you don't just recover after one night's sleep. But they'll notice a difference the very next day. It's really remarkable. We've had a patient, as a matter of fact, who's was a father of 4 different boys, and he was just constantly really, really stern and actually not a very pleasant man. After he started wearing an appliance, after about a month or two, his kids couldn't believe he was like a different guy. His temper wasn't short. He had a lot more energy for the boys, goofing around with them in the backyard. Just a different person, just by sleeping. Think about how you feel if you just miss one night's sleep or 2 nights' sleep. Now imagine if you were missing, like, that's all you ever got. So you were constantly exhausted. It changes your personality. And so This family actually was changed by just one person, the father, finally resting and sleeping at night.
So it really is life-changing.
It is life-changing.
So is it more men than women? I mean, do women rarely get this?
No, it is more men than women, but women get it too, and women can be the partner that snores. We'll have men that say, although less frequently, that say that their wives snore. Is there anything you can do about it? But there's still a substantial 40% of the patients that have sleep apnea are women, and 60% are males.
So I guess when you don't sleep, I know the way I am. I mean, I'm more likely to have pizza or garbage if I only get 4 hours sleep.
Well, there's actually a reason, not just during sleep, when your body's actually rebuilding itself. There are different factors in your body that control appetite. And there are studies now that are showing that patients that don't get a proper night's sleep actually have more of an appetite the very next day. So there's actually something to it.
So take me through the process, and we're closing in on time. Okay, so for people just tuning in, we're talking to people that have CPAP for their sleep apnea, and they don't wear it, right? They can't, or even maybe their CPAP is okay, they're tolerating it because now they can sleep, they have more energy, but they'd love a better solution, but they don't maybe believe an appliance would work. Because is there a group out there that maybe they're going, well, my CPAP works, I'm not going to touch it? How do you determine whether they would be good candidates? Or are you only focusing on people that really can't tolerate the CPAP?
So we work with the patient's physician to figure out if a patient's using a CPAP and they're diagnosed with severe sleep apnea, the recommendation is to continue using the CPAP. Even those patients, though, some of them for traveling, they may want to have an appliance that they can wear. The problem is the patients, the 50% of the patients that have been prescribed CPAP that just can't tolerate it.
Well, this makes sense, though, like you say. So you could have your CPAP for home, and if you travel, you could have an appliance made for traveling.
Right, and a lot of patients do that. They'll have an appliance.
Do they ever switch and say, forget the at home? Because it sounds like the appliance is much better than having a machine you got to wear.
The appliance is much better. The CPAP will be more effective for a patient with severe sleep apnea, so they actually may feel better rested using a CPAP for someone with severe sleep apnea. But if they're traveling just a couple of nights, they may prefer just to be able to go ahead and not have to carry all of these extra things with them.
Now, we're short on time, but the process. Okay, so somebody's wearing a CPAP, or maybe they're a really loud snorer. The spouse is watching this and they're going, maybe this will stop the snoring. This is off-label, right? I mean, when you use this appliance to stop snoring and you don't have sleep apnea. So before, in our office, before we would fabricate an appliance, we would have to rule out sleep apnea. Okay.
And the way we would rule out sleep apnea is with a sleep test, and a physician would make the recommendation one way or another.
So what's the process? If somebody comes in, they have their CPAP, and now they're willing to give this a try, how soon before you think or can look at a reading and say, this probably is going to work for you?
So the first thing we would get is we would get the sleep test that was already done before the patient got the CPAP. We'd take a look at it. I'd contact the physician, get the approval from the physician, and then at that point we can start the process. Then we'll take a three-dimensional image in the rest position. We can actually measure how the airway is. We'll do a series of oral exams and extraoral exams. We check the jaw joint, make sure that the patient's healthy, and then we'll go ahead and we'll take images of their teeth on the top and the bottom, and we'll take those images and we'll import them onto the scan. So in the scan, we'll actually be able to see their teeth, their jaw joint, and their airway.
From that, do you think this is going to be good?
And at that point, when we advance the jaw on the scan, we'll be able to see if it's going to be effective for that patient.
So you'll know?
Yes, because you can actually see the airway open.
Do you tell them? What do you say? This is going to be good?
No, we show them. We show them the before and after. We put them next to each other, and they can actually see that the airway is open on the CT scan itself.
Okay, good. So you've had great success with this new next generation appliance.
It works phenomenally.
Why do you like this so much? Because I know you do dental implants, and I know you do cosmetic dentistry, and I know you do a lot like same-day dentistry. But like when we talk on the phone, you seem to be the most, maybe I'm reading into this, but you seem to be the most excited about this topic.
Well, because
Why?
A lot of things help patients with the quality of their life. Having a beautiful smile helps the patient with the quality of their life. Taking a patient that couldn't bite into an apple and having a mouthful of implants or a mouthful of teeth, not implants,
Yeah.
and having a beautiful smile is wonderful. Same thing with veneers. But this actually affects their health. I mean, this affects their ability to function on a day-to-day basis. This can actually make their life longer. If they're less at risk for heart attacks, they're less at risk for strokes, they're less at risk for having hypertension, they're more alert. They can just enjoy themselves on day-to-day activities. I mean, it's not a dress rehearsal. We got one whack at it, right? And so if these patients, if I can help people actually have a better quality of life as a dentist.
Because they have more energy if they're sleeping.
Well, they have more energy and their bodies are healthier. At night, their bodies are actually doing what bodies are supposed to. They're healing, they're rejuvenating, they're getting ready for the next day. It's amazing that we can, with a dental appliance, as dentists, that we can fabricate an appliance that allows a patient to sleep better, and the patient actually has a better quality of life. And so does their family too. So,
yeah, because I guess if you're in the house of somebody that's a super loud snorer
and grumpy,
and mad all the time,
and hasn't slept, and nattering all the time, and all of a sudden the person's personality comes out and they just enjoy life more. I mean, it's wonderful. It's wonderful. You know, I've been practicing almost 30 years. And so I've got,
this is a happy group of patients.
I've got about another 15 years, God willing, to be able to practice. And I would like to be able to help as many patients as I can have the best quality of life they can. And this is huge. This really allows patients to be able to enjoy life and whatever activities they want. And they don't just feel sedentary, they don't just feel exhausted, they don't just want to nap all the time. They're up, they're out, they're doing things with their spouse, and they're not affecting their spouse as well. So it's to be able to be involved with healthcare workers, physicians, to be part of a team that treats patients with a disease that a lot of patients don't even know they have, to make them aware of it and then help them is a nice gift to be able to give to others. It's
so do you
phenomenal.
get thank you cards or anything of that stuff?
Yes, as a matter of fact, we do. We get a lot of thank you cards, and that's and we get a lot of wonderful reviews from patients, and that really is what makes this worthwhile. Is that
Good.
You know, to be able to take patients and just help them have a better quality of life.
You're going to wipe it out in Illinois?
I'm going to try, and part of Wisconsin too.
I want to thank you for coming on the show. Always a pleasure. Thanks for coming on. So if they want to get a consultation,
Yes.
they get to see you,
Yes.
right? So they bring in their CPAP, or they leave their CPAP at home. They bring in their sleep study, maybe that's a year old or whatever,
Yeah, year-old's fine.
and they bring it into you, and then you do some imaging, and say, "This is your lucky day."
Yeah, absolutely.
I'm putting words in your mouth,
Right.
But
and we
it's-
work with their physician, and then we make sure that we can get them taken care of and get them off the CPAP.
Okay, good. I want to thank you for coming on the show. Always a pleasure.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.